It's recording now.
Okay.
Okay.
All right, this is our weekly, welcome everyone. This is our weekly meeting with the medical staff of this clinic. And we talk about difficult cases, what to do about certain people who are struggling. And it's edifying as to how we manage the medicine, the delivery of Chinese medicine in our clinic. This is Nim. I don't know if you can see him. You can stick your head in the camera there. Nim, he's one of our residents. This is Edward, and this is Kylene. And so let's start. Let's have the first case up here.
Okay, first case is Tom.
Okay.
And Tom is 94.
Yeah.
He has pain everywhere, from his neck down all the way bottom of the spine. His hands, a lot of pain in the hands.
Is he getting better?
Very, very slight.
This is the doctor, right?
Yes.
Okay. Here's the situation, and this, you have to be very careful with the elderly like this because very often they don't feel the needles. Mm-hmm. And you can be fooled. You can put these needles in and you think they're just stoic, but the truth is they don't feel the needles at all. If they don't feel the needles, it won't work. So sometimes you have to use 2 needles at once. So they're going, oh, ow, 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 and then you will start to get results. I know this patient, and that's exactly what's happening. So he has a lot of back pain. You have to, with the back pain people, chronic back pain, you've got to put the needles in the tummy, opposite from where the pain is. And not just one needle. I'd put in, 15 needles in there. All because pain's never in one spot, it spreads over a whole area. When you shoot thermal scans of people's back, you don't just see one little thing. You see a whole area of red. And that just shows you how big of an area pain can reside in. And so that's why it's a mistake to use a distal method of acupuncture, like the balance method or Chow Chen's method, and just use one needle. Like Ling Ku to treat back pain. That is just not enough. You're not spreading the effect over a large enough area. So you just decorate. You just figure that, they might say their back pain hurts right in a spot. Figure it's that one spot is that spot. And just spread the needles over the whole area. And then if they're really old, you've got to make sure that they feel those needles. Like, did you feel that? Oh yeah, I can feel that. Well, you mean you felt it going in? Yeah, I felt it going in. You feel it now as you're twisting? No, I don't feel anything. It won't work. You've got to do this, up and down, and up and down, and up and down. Oh yeah, okay, I can feel that. You have to do that with each needle. Your results will go up exponentially. Okay?
Okay.
Very important. That's his problem. Doesn't feel the needles enough. His ankles and his feet are purple, so he has severe blood flow problems. So you already know it's going to be difficult. That's why in his case we didn't lay out a 4-month plan. We laid out a 1-month plan because we just saw in his initial first 2 visits that we might have a tough time with this guy. Mm-hmm. But he's so nice; he doesn't miss a visit. No. I think he likes it here. And he told me today when I saw him, he said, yeah, it's better. He said, it's not dramatic, but it's better. The mistake we made, not enough stimulation on the needles, for sure.
Would you use electric stim?
Yes, but he has a pacemaker, so he can't.
That's right.
But if he didn't have the pacemaker, that's the time to, on the tummy, use the electrostim and just really get it going.
And do you say it's on the opposite side?
No, it's
on
just
the same side, right?
both sides. If he says he has pain on the right side of his spine, in the lower back, you don't just treat exactly opposite the right side. Spread the needling area over the whole abdomen, all the way over to what would be considered the gallbladder channel over here. All the way over to the side of the abdomen.
Okay.
Yeah, because without a thermal scan, you can't tell how widespread the pain really is. But I guarantee you, it is widespread. Nobody just comes in with a white dot on their back and no redness anywhere else. Mm-hmm. The mistake made in these, as I said, in these distal methods, is people relying on one needle, one magic needle to take away a whole area of pain. Yeah, sometimes it can happen, but we're not in the business to try to convince people we are Dr. Jesus. We're here to help patients. If it means using 30 needles, so be it. Okay? So that's it for Tom. Who's next?
I have a patient, Regis, and we've been treating her for 3 months.
Yeah.
She's improving. She's about total 40% improved. So she's slow and steady.
So she's 3 months into it.
She's 3 months in, and she's about 40% better. We've been giving her blood movers, also things to open the bowels for 3 months.
Okay.
But her pulses haven't changed much. Pulses are still very low.
Are they deep?
Very deep.
Okay. Is her heart pulse weak?
Heart pulse is weak.
Okay. With these kinds of patients, blood movers alone won't work. They will help a little bit. But if you want the pulse to come up from the depths where it belongs, it needs to come up, then you have to use a Huang Qi-based formula along with the blood movers. So whenever you're feeling the pulse and you see that deep pulse over the whole body, you know you're going to have to use blood movers. So then it's just a question, do you protect the heart from the blood movers or you do not? If you see a deep pulse in the left sun and it's pounding, I mean strong, you do not need to protect the heart. The heart's strong. In fact, they have an inflammatory condition. So you wouldn't just use blood movers, you use anti-inflammatories. You know, the Huangs, all the yellows, that kind of stuff. Maybe 20% or 30%, the rest are blood movers. But with this kind of patient, she's 52 years old, with this kind of patient where the heart pulse is deep and a little weak, then that's when you use something like Feng Ji, Huang Qi Tong. Works great. It will help to move the blood better. Okay, so it sort of drives the blood. When you're just using blood movers, you're just using vasodilators and blood thinners basically. But when you add in the Huang Qi-based formulas, now you make the pump work. She will do better if you add that into the formula.
If I think we've used it in the past, do we just
gotta
use
stay with
a
it.
bigger, so
Bigger
stick
amount.
with it?
Go
What
add.
would be the ratio of
If it's 20%, then go to 30. If she still says she's tired, go to 40. Now you have to watch carefully. If you start adding more of these Huang Qi formulas and suddenly go, actually I feel worse, then you screwed up. Then it's probably the culprit's in the liver. So it's not just a blood mover, you've got to look to detoxify the liver in these patients.
Okay.
Because if you start adding more Huang Qi, they should have more energy, as long as the blood movers are in there. See, let's say you're giving 20% Feng Qi, Huang Qi Tong, and 80% circulation Sanjiao, okay? In this clinic, we call it, we have our own formula, it's called Vitality. It's basically circulation Sanjiao with some diuretics in it, and more shui zhi, more leach. So let's say you give them that 20 and 80, and you give it to the patient, and they come, how do you feel? I feel better. So then they give it to them again, come back in a week, how do you feel? Oh, about the same, maybe slightly worse. Okay, something's wrong. Either there's too much blood movers, okay, or there's not enough Qi tonic. Or, it's like there's not enough Qi tonic, or you need more blood movers. You made a mistake with the Qi tonics. So you got to go one way or the other. Kind of have to, you're not guessing because you're reading the pulse. So you look at the pulse very carefully. 1 week of blood movers, you'll see very clearly what's going on. The pulse is going to change, it will come up, and the heart will reveal itself. Is it weak or is it stronger now? If it's stronger, then you don't, that Huang Qi stuff is screwing things up. You got to drop it back to like 10 grams. You need more blood movers. If the heart comes up but it's weaker than you originally thought, then you know the culprit is a weak heart. So then you use 20, then you increase the Feng Ji Huang Qi Tong to maybe 40 grams and reduce the blood movers to 60. And then they'll come back, how was it? They'll say, well, it's much better. So it's looking at the heart vis-a-vis blood stasis and kind of playing with it. This type is pretty easy because she doesn't have a lot of inflammation.
Mm-hmm.
If they have a lot of inflammation, if it's deep and pounding, you have to use the blood movers, and then you have to use the heat clearers at the same time. Mm-hmm. And you've got lots of choice. I mean, you could just use Long Dan Shui Gan Tong, quite frankly. 20%, and they'll say, well, I'm better, but I'm still tired. Then 30% Long Dan Shui Gan Tong, as long as the pulse is pounding and deep. Deep means blood stasis, pounding means heat. Clear?
Mm-hmm.
Okay, good. Next.
Okay, my last one, patient Jan, 62-year-old, fit lady. She's in shape. She keeps waking up with really high blood pressures, sometimes even 170s over 110s. We've tried many different approaches towards getting her blood pressure down. The mix you see here at Da Huang, the San Huang Xie Xin Tang, with the astringent and stress one. She has the best results with this, but it's uncomfortable for her digestive tract.
Yeah.
And so,
Okay, here's what you do. She's not overweight, right?
no.
Okay, these types who have high blood pressure, not overweight, these are your typical primary hypertension cases. These are very difficult to treat. You should just know it straight up. If the patient's overweight and has high blood pressure, that's a slam dunk. We'll just get them to lose the weight. They lose 20, 30, 40 pounds, watch the blood pressure come down. But when they're sitting in front of you and they look fairly, physically fit, but they have high blood pressure, and I'll tell you, it's almost always from childhood. I mean, they just had high blood pressure. This primary hypertension is usually driven by a genetic arteriosclerotic problem. The pulse is tough, hard. So when the blood moves through the vessel can't expand very well. So it creates too much pressure inside the vessel, i.e. high blood pressure. So what you can do with this patient is, first of all, they probably have to be on blood pressure medication.
She's been trying to avoid it.
We need to get her on it because it's too dangerous. She could harm the capillaries in her kidneys and hurt the kidney. Okay. Secondly, it appears that the best approach is a lot of Da Huang and Meng Shao, because it will soften the vessel wall. Those herbs will soften the vessel wall. They're like lisinopril or Benicar, without the bad side effects. And that's the stuff that worked the best. So it was Da Huang, 15 grams, San Huang Xie Xin Tang, 15 grams, astringents, 20 grams. We have an astringent formula here which has 5 astringents in it: Huzhe, Ubeizi, Tianhua, Fenbaiwei, and Subaya. Then in this case, we used dissolved kidney stone, which is a formula from Evergreen. We used the circulation Sanjiao, 30 grams, and then we used something to protect her digestion, and Anjiang San. The Da Huang's causing her some problems, which can happen, so we have to drop the Da Huang back. Instead of 15 grams, 10 grams. And then she needs to take a dose of this before she goes to bed, because the blood pressure hits in the morning when she wakes up. So there's just too big a period of time when she's taken her last dose of herbs during the day, which is probably 5 o'clock in the afternoon. And the next day, when she wakes up, then she has high blood pressure. So she needs to take 2 spoons before she goes to bed.
So an extra dose then?
Yeah.
So she'll have 4 doses
Yeah.
throughout the
Make
day.
sure that she doesn't have any raw food,
Yeah.
and take the herbs after she eats.
Okay.
The rule of thumb with herbs is this: if the problem is above the waist, take the herbs before you eat. If the problem is below the waist, or the abdomen and below, then take the herbs after you eat. And after means like a half hour before or a half hour after. That will mitigate a lot of the digestive issues that people have with Da Huang. Okay?
Okay.
Good. Any more? Edward? You got somebody?
Yep.
Yeah, okay.
Yeah.
Hold on a second. I have Sharon, okay, 67-year-old female.
Yeah.
My main concern is her restless legs. It is slow progressing and...
Okay, her main complaints were restless leg,
Yeah.
high cholesterol, fatigue. She wanted to lose weight, and she
Yeah.
has an insomnia problem.
The main thing is the restless legs.
Okay.
I just want to know about your approach between either acupuncture and herbs.
Okay. I would give her that Padma formula
Yeah, we did.
for a couple of weeks.
Okay.
And this is a strong blood mover for the vascularity in the legs.
Mm-hmm.
Did we try that?
I think we did. We tried Pamela already. Yeah, we did.
Okay, we did. Okay. Have we tried giving her large doses of magnesium?
I don't believe so.
That's the next thing you want to do.
Okay.
Actually, it's the first thing you want to do. Give them magnesium. Very often it's just a magnesium problem. That
Oh.
generally will solve it 70% of the time.
Oh, okay.
How far overweight is this gal?
Not too much.
Okay.
Not too.
It's probably a magnesium problem. When they're really overweight, it's usually an ischemic problem, blood flow problem into the legs, and the legs start jumping around because the motor nerves lack nutrient due to blood flow problems. The motor nerves start to act up, and then of course the muscles start to spasm. So generally, I've had. I can't think of a restless leg problem I didn't fix or come close to fixing. And I either got it done with the magnesium or I got it done with the strong blood movers into the legs.
Okay.
Shen Tang Zhu Yu Tang, something like that. Even Shu Jing Huo Shui Tang. And then you can use Shui Zhi and things like that. She shakes, this one.
She doesn't shake. It's just that from time to time, when she's lying down,
Yeah.
especially in the later in the evenings, around 9 or 10 o'clock, her legs will just, out of no reason. She said she can actually feel in the lower,
Shaking.
in the hips.
Okay.
And then it comes to here about swing 10.
Then what you want to do is you want to use a combination of Xiao Yao Gan Sa Tong, and you can use Yan Hu So.
Okay.
And for the spasms, Chuan Liang Zi, Chuan Liang Zi, Yan Hu So, Xiao Yao Gan Sa Tong. This will stop the spasms. Then you have to use vasodilators. The best, Tang Gui, Chuan Xiao, for the legs. Then you use a guider like Du Huo, just a little bit of it.
Yoshi.
Du Huo, Nu Shi is another one, yeah.
Okay.
And generally when you start adding the Chuan Xiang and the Dong Gui is when you start to really get somewhere. You can crank those guys up to 15 or 20 each. Okay?
Okay.
Now you have to pay attention whether she's too hot or too cold. If you don't have a thermal scan, just touch your legs. Touch them. See, how are they? Feel cold or they feel hot? If they're cold, then you know the blood movers have to be very strong. If they're hot, then you're going to have to use an anti-inflammatory in there. If you're in a hurry, just throw in gardenia complex. It's cold. Just put it in there. Or if you want to get fancy, you can use, Xuan Shen and Xingdi, things like that.
If not, then Seattle, just straight, like something like
Yes,
that.
yeah. We call it Seattle 1, but it's really gardenia complex. Okay. Now we did use Chuan Xiang, but we didn't use Dong Gui. And we didn't use strong, we only used 10 grams each. You should take it up to 20 grams. See, look, the blood can't get into the leg very well. So what happens is the sensory nerves are not fed enough oxygen and enough nutrient. The motor nerves are not fed enough oxygen and nutrient. So what happens? They start having numbness in the leg, tingling in the leg. That's a sensory problem. Then they have, their legs start jumping around. That's the motor nerves are firing, contracting the muscle groups in the leg. It's just due to blood, it's this blood stasis problem. And the blood stasis is either due to too much cold in the body, or too much heat, or too much weight. If there's a lot of fat in the midsection, it will literally cut blood flow through the mesenteric artery into the femoral artery by 50, 60, 75%. And for those people, you have to, and being overweight means they're going to be inflamed. There's going to be obesity is an inflammatory disease. So when they're overweight, rarely will you find a cold blood stasis problem. It's almost always heat, and that heat has to be dealt with. Okay?
Okay.
So you use vasodilators, anti-herbs, and herbs on top of that, which are very cold, and then strong blood movers. And you can just resort, you can get Du Huo, Dong Gui Nian Tang Tong. Dong Gui Nian Tang Tong if it's heat, Shen Tong Zhu Yu Tong if it's cold. If it's really cold, you can add in Dong Gui Xini Tong. Dong Gui Xini Tong is really cold.
Okay.
If it's kind of neutral, not hot, not cold, Shen Tong Zhu Yu Tong. If it's hot, Dong Gui Nian Tang Tong. Then you put in the Chuang Xiang Dong Gui in there as well. And then you can add, if it's really clogged up blood flow, Shui Zhi, Di Long, things like that. And it will get better. It will.
It's cold. It's cold. You don't play so you don't.
Don't waste the time with the spasms. Like don't use Tianma and Goten to get rid of spasms. That's not what it is. And the Xiao Yao Gansan Tong, if you have to look at, that's only if the pulse is extremely thin. because it's sweet. Sweet herbs expand very narrow pulses and very narrow vessels.
So it's not open till.
Yeah, you wouldn't use that if you have a heat condition, okay? But you can use Chuan Lianzi and Yan Huso. The combination of Chuan Lianzi and Yan Huso stops spasms. Okay? Good. So that's how a typical Thursday afternoon meeting goes in here. And it's always fun to go through these cases where we're having a little bit of trouble to try to make it better. Most people go through a 4-month plan in our clinic, and during that 4 months we usually treat 6 or 7 or 8 things. And we use acupuncture to treat mostly the pain issues, we use herbs to treat the systemic problems, and we use weight loss and nutrition to treat the overweight condition. All 3 are provided together simultaneously, and it works very, very well. Thank you very much. Bye.
Okay, so
It's a silver one on top.
Right here.
Wait, no, no.